women and child health care. So, women and child health is a key priority for the healthy communities. Next. So, with advantages like diversity, low cost, low uh, medicinal side effects, and growing popularity of natural and organic products, Ayush can play a very important role in women and child health care. So, with this, I am introducing the chairperson of this session, our renowned Professor Dr. Devendranath Mishra sir. So, he have completed his BA MS from State Ayurveda College, Lucknow. I welcome sir to the dais. Welcome sir. Sir did his MD in Prasuti Tantram and Bal Roga from BHU. He has more than 30 years of teaching experience. More than 60 articles were published in national and international journals. The national award, and he has got Saraswati Samman. He is the editor of 6 journals, guided PG and PhD students. At present is a visiting professor, PG Department of Kaumara Vidya, BHU. A warm welcome to you, sir. Next, I welcome the co-chair of this session, Dr. M.Prashanti Singh, sir. Sir, kindly welcome, sir. Sir is working as an associate professor in more than 13 years of UG and PG teaching experience. He has published more than 20 research articles. He is a reviewer of peer-reviewed journals. He is a general secretary of Kashyapa Association of Ayurveda Pediatrics. Welcome you, sir. Sir has pursued his BHMS from HKS Homeopathic Medical College, Gulbarga. He has completed his MD. He is running 3 clinics in Hyderabad. He has contributed more than 500 articles to the news dailies and dozen of published articles in various national and international homeopathy journals. He has worked with Dr. Vijay Lakshmi Venkadeshan, a stem cell research scientist, and he published his research in World Journal of Pharmaceutical Research, Government Ayurveda College, Nagarkoil. So, about this session consists of 9 presentations, and keynote speaker will first address will give 15 minutes. The best paper will be awarded at the valedictory program, but at the end of the session, the winner will be announced. So I request all the participants to wait till the completion of the session. So these are the criteria where the assessment was made. So time, scientific relevance, scientific methodology, clarity of presentation, and elements of new knowledge. With this, so I give. You want to give rules?
Welcome to Swasthya Expo function. Welcome to Swasthya Ayush.
Comes to the chair of this session, Dr. D.N. Mishra ji, and the co-chair, Dr. M.Prashanti Singh ji, and my good friend, young coordinator of this session, Dr. Sunil Roy ji, and the organizers of this beautiful conference this evening at Hyderabad, Swasthya Expo, and some good people behind this like Jiva Sri Foundation, who have done a great job in seeing that such a beautiful conference comes to the twin cities of Hyderabad and Secunderabad, and probably triple cities. Now this is the high-tech city, so we have more to contribute from this city, and some very good friends are young homeopaths, Ayurvedic physicians who have done a lot of work to see that this job gets done here in this city, like Dr. Kalpana, Dr. Vaidehi, My greetings to all of you and all the people who have assembled here to see this conference go through, and my elder brother like and my counsel Dr. Gopal Krishnaji, and my great friends Dr. Madhu Varnasi and Dr. Mahesh Pagadala. Very good evening to one and all. Whenever we meet at any conference, there are a few points which we need to share with others. Like our fraternity, we need to share with them what we have done something differently, how we have presented things differently, how we have brought some things on paper. And there are also some necessities like that we need to address, like having to come on stage to understand and also make the society aware that what we are able to contribute or what we can contribute in the days to come, and also society in general and government in particular, that we are capable of some things that we can do. And India is a beautiful story that is going to happen. It has been a developing country for a while, and with 75 years of independence, now we are, and what things have to come up. We have a beautiful, rich culture. We have a heritage that has seen our country through various centuries. At the same time, for having to, you have seen many cultures disappear from this world. If you go to Middle East, there were something different cultures of the past, but our Sanatan culture has remained forever. So what is the intrinsic strength of our culture? There might have been something apart from this culture. There has been something which has been seeing us through good health, which has been keeping us through better frame of body and mind. Yes, definitely medicine and healthcare, which probably is ancient in our earlier days. That has also given us the strength to stick to the reality of Vasudhaiva Kutumbikam, and that lives with us today. Having said that, we are now going to be the fifth. So now you could say that Ayush is Ayurveda, Unani, Siddha, homeopathy and several other things, and homeopathy is a very foreign dollars, while Bangladesh spends just a little over $34,000 per year. And at the Sudan, which is one of the poorest countries in Africa, they spend only about $13,000 a year. Switzerland tops the list with spending of $4,999 per year. Why I am talking about this expenditure is, like, we don't have any, not helping them. So why not carry on our good work to the other parts of the world and bring on some good, the Philippines spends about $917,000 every year. Nepal spends about $202,000 every year. Why I have taken different parts where developed, underdeveloped and developing countries is, even the poorest countries are under duress to spend so much of money for healthcare, while the richer countries are spending more money on probably tertiary healthcare. So even the war-stricken poor country where there are no resources like Afghanistan, they spend about $240,000 a year. Dr. Shiv Shankar sir would say, you just give a few doses of Chininam self and it's good for gone. And clinically we can support that statement with having treated so many patients. So even for malaria, where probably there is very little that other systems of medicine can do. A country like Congo spends $140 million every year, and Ethiopia, the poorest country where they don't have anything to feed their citizens and they have to depend on food from abroad, they spend about $167,000 every year. Nigeria spends $210,000 every year. Senegal, they spend $4,000. Zimbabwe, $50,000. Philippines, it's $16 million a year. So even if we can treat malaria with homeopathic medicine for Africa, we can save so much of their money, and with goodwill we can probably attract more number of nations to understand what we can do, and the amount of help that we can give them. So this is the malaria story that we were talking about. And even for example, the infectious and parasitic diseases too, they spend a lot of money. Ethiopia spends $40 million every year, Zimbabwe 63 US million dollars, Bhutan $19,000 million, Nepal 18,000, Philippines 18,000, so on and so. For example, there are so many surgical conditions like tonsillitis, adenoids or hemorrhoids, which even to the grade 2 and the grade 3 we can safely take care with homeopathic medications, and we can see that the country's expenditure so much is reduced. So India is the only country where we have so much rich culture. Like just yesterday our Prime Minister said, in the land of freedom, what they call as the United States of America, democracy is in our DNA. But if there is some democracy in healthcare, the first country would be India. Do you agree with me, young friends? Thank you. So that is because we give room to everyone, whether it is Ayurveda, Siddha, even in Tibet they have, but you go to the West, they do not have much of medicine knowledge from the past, like the rich culture of Ayush that we have here. So this is what we can do for our country. So So if we can have just simple OPDs, we can do the walk the talk that we are talking about today, and we can give the knowledge transfer or knowledge capital to the world as far as Ayush is concerned, and not forgetting the fact that there are many things apart from that. Health is also a state subject. Even the state can take decisions. Even our own Telangana can tie up with Sri Lanka and say we can set up some institutes there, we can have an outpatient department there. It doesn't mean we have dynamism of governments both at the center and state. Let us appreciate, let us try to insist upon them that we don't want money, we'll bring in the money, we'll pull in the money. There are so many capitalists with their names starting with A. In our country they can give us a lot of money. That's not a big problem. We have the talent pool that we can supply, and it's only a matter of 2 or 3 years that the world will understand that what Ayush can do. And like today the world is spending about $8.3 trillion for health according to World Health Organization's estimates. $8.3 trillion every year they are spending for health. So let Ayush, Jai Homeopathy, Jai Hind. Thank you so much, sir.
Thank you, sir. Thank you very much for your thought-provoking speech. Next, I am going to invite the first participant, Dr. Ramesh Chandra Nayak, to the dais. So,
respected persons, professors on the dais and of the dais, and respected today's keynote speakers, and also students from homeopathic, Ayurvedic, and also the organizing committee. I am Dr. Ramesh Chandra Nayak, that I am professor and head Mechanical Engineering Department from Odisha, Synergy Institute of Technology, Bhubaneswar, Odisha. So actually, it's a good platform I found. I think whatever the topic I want to present here, it's totally different. Actually, because while I entered and from today's morning, I found that all the topics are related to Ayush. It's a very nice. But honestly, I want to tell that I will justify. Actually, whatever the topic I will explain here, so that's a technology based. Because being a mechanical engineering, that I have already completed my PhD in thermal specialization, and also now I am working on agriculture sectors also. I have developed 4 to 5 number of products that are in TRL 9, technology readiness level 9 stage. Now, that I have developed a product that's related to Ayush. Actually, in our Odisha, that Ayush MO, that my wife, Dr. Swarnaprabha Rautra is also here, that by taking some concepts, that I have developed a new product, that's smokeless chula. Because we know during COVID, we found that as per the WHO, from literature review references I found, that is 60 to 70% in India or in world, that is 60 to 70% cancers, throat cancers are due to household smoke. It's a very big problem for us because we know especially I can give the examples in Odisha. Here 70 to 80% people are villagers. They are cooking 3 times food. Actually, our Odisha persons are very much favorite on rice. They are taking rice at night also. So for that reason, they are preparing their food 3 times in a day. So that all the 3 times foods they are preparing by using wood and also by using that general traditional chula. So in a room, single room, that 6 to 7 persons are staying, including their children, and they are cooking the rice by using that traditional chula. That whatever the smoke out, that's a very big problem for their family members. So, so my topic is that fabrication of a smokeless stove for preserving rural women health. And we found generally the COVID affects the respiratory system of the human body. So the persons having good health conditions, they survive, but neither suppose some small, whatever the effects they found on respiratory systems, they dies. So by taking this concept, that we found that chula, which is known as stove, or the product I have developed here, a technical word is their calorific value of the fuel. So if calorific value of the fuel is completely used, suppose a fuel, so but smoke, maximum smoke will be there. For that reason, and technically concept, that whatever the product we have developed, the first point we have taken, that for complete burning purpose of the raw material. Again, whatever the in traditional chula, for 1 hour, that it is that traditional chula consuming 4 kg of wood for 1 hour complete burning. But whatever the product we have developed here, that in 1 and 1.5 kg of wood, and some technology we have developed here. I will later on I will describe whatever the technology we have developed here. By that 1.5 kg of wood, that gives complete burning in 1 hour, and that whatever the thermal efficiency found by traditional chula, our developed chula gives 3 products greater than the thermal efficiency as available before of the traditional chula. And popularly we in our Odisha, we are telling this chula, it's a smokeless chula. It's a magic that here, that complete, I can't tell that it's a complete zero smoke will be there, but some initially the smoke will be there, but after that, that smoke will not available. So why that technology I will tell. And this is my experimental setup. It consists of 3 layers and having cylindrical cross section. Outer cylinder, middle cylinder, and another is the inner cylinder. And whatever this point, so this that no completely burning is there. So this is the results from IMMT. We have already tested whatever the velocity, that carbon monoxide and carbon dioxide, that TPM, total particulate material, calorific value of the fuel, and the thermal efficiency. Whatever the thermal efficiency we found, that is maximum than whatever the traditional chula that was before.
Time over.
Okay, sir. Thank you, sir. Any questions, sir?
What is the process of that stove and all?
Yes, sir.
All right.
Okay, thank you.
Thank you, sir. Namaste.
Dr. Ashma Ume Shalma to the stage. There.
Government Nizamiya Tibbi College. I'm a PG scholar. So let us begin with a case scenario. So basically, let us begin with a case scenario. A 56-year-old woman, when she comes to your OPD with a complaint of lower pain in joints, and excessive urination, indigestion, postmenopausal syndrome, modern and Unani concepts, incidence, prevalence studies, indication of hormone therapies and associated risks, and replacement of hormonal therapy with holistic approach of Unani medicine and diet therapy. So to know what's postmenopausal syndrome, we should know what's menopause. Menopause is the permanent cessation of menstruation for 1 year or more with progressive declination in estrogen and on endocrinological system. The average age of women experiencing menopause is 50 years. The diagnosis is made with 50% of classical symptoms and is confirmed by increased FSH levels and decreased estrogen levels. Other types of menopause is premature menopause, delayed menopause, artificial menopause, and surgical menopause. So these are many symptoms of menopause. The classical symptoms are hot flushes, night sweats, vaginal dryness, decreased sex drive, and most common is joint pains, that is due to the osteoporosis. So to know regarding menopause, we had to know what is pathophysiology behind menopause. So in body there is a decreased secretion of estradiol. Intent, it acts on CNS, urogenital system, cardiovascular system, and bones. So the symptoms are hot flushes, night sweats, sleep disturbances, and in urogenital system there is decrease in collagen synthesis and blood flow. This intent led to stress incontinence, pelvic organ prolapse, and intent, it might lead to dryness, irritation, infection, and dyspareunia. In cardiovascular system, increased cholesterol level might lead to the risk of atherosclerosis and risk of myocardial infarction. And in bones, there is decreased bone resorption, and Reza is a diet therapy, and Ilaj with Tadbir is regimental therapy, and Ilaj with Dawa is pharmacological therapy. So briefly we'll see Hippocrates is the great philosopher. He postulated a concept of coldness and dryness in the temperament, and Aristotle said that regarding menstruation normally ceases at the age of 40 years. Ibn Sina described regarding the clinical symptoms of postmenopausal syndrome, and this is known as Cineas. According to cold and dry temperament theory, postmenopausal syndrome must be treated with hot and moist diet, and it's recommended in Unani system of therapy. So let me say you why postmenopausal. So in that 100% of women, 70% are unaware of postmenopausal treatment, and a research was done by Indian Menopausal Society. They stated that the population in India is 1.4 billion. Among them are the menopausal population is 103 million. The average age of menopause is 47 years, and from 47 years and the life expectancy is 71 years. So majority of women might spend their 1/3 of their life in postmenopausal state. So the question here is 20% of 173 million take treatment. Thank you one and all.
The disease.
Yes, sir.
So, by your example, I want to convey to the presenter, when you present your paper, concern or concise your to the topic. Whatever the review is there, disease part is there, that you finish early. Everybody knows what is the disease description, sign and symptoms, and all modern aspect or subject aspect. What you want to convey, come directly to that point. Otherwise, you will not have your time for the real topic.
Yes.
And whenever you present a review article, try to collect some of the clinical data, because without of the clinical data, everything is present in the literature.
Yes, sir.
If there is no clinical data, or if you don't have a clinical data, try to collect some elements, try to collect some scientific basis on the ground on which you are collecting the reviews and presenting at that. Thank
yes,
you.
sir. In single drugs part, I have showed article references. So due to time constraint, I didn't elaborate that. Thank you, sir.
Next, I invite Dr. Farsana Firdous.
Structures. You can see one side there is a normal uterus, and from another side there is a inflammatory exudate. How a woman get PID? It attributed to the ascending microorganism from the cervicovaginal gland to the contiguous pelvic structures, causing endometritis, salpingitis, pelvic peritonitis, or tubo-ovarian abscess, excluding cervicitis. Historical background. From the very ancient Egyptians, they know about the infections of genital tracts. In the book Kehul Papyrus, there is a description of itching of the vulva, and there is description of the medication for putrefaction of wound. In her papyrus, there is a description of from BCs only. They describe the genitourinary disease in women. As papyrus, they describe the female genital disease, vulval itching, inflammatory part. Hippocrates described the strangry, putrefaction from venereal pleasure. He was aware of the pelvic abscess and pyometra. Soranus of Ephesus described the rectal inflammation and uterine and rectal there is inflammation and increased vascularity of the edema, and in intiha, that is peak of inflammation, and in hetad there is termination either through resolution or through suppression. Microbiology, it is microbiological inflammation. Primarily affecting organism are Neisseria gonorrhoeae, Chlamydia trachomatis, Mycoplasma hominis, and the secondary affecting organism is presenting sooner or later. That is aerobic organism, non-hemolytic streptococcus, staphylococcus, and aerobic organism is Bacteria fragilis. Clinical features, symptoms, there is a lower abdominal pain, backache, fever, malaise, abnormal vaginal discharge, dyspareunia, heavy bleeding, pain and discomfort in right hypochondrium. Signs, fever of 101 degree Fahrenheit or greater, bilateral lower abdominal tenderness, abnormal vaginal discharge, abnormal uterine bleeding, deep dyspareunia, cervical motion tenderness, adnexal tenderness.
Kindly check your presentation.
Under Swasthya Ahara Vidhi, and but the principles of pediatric nutrition are found scattered in various texts. These have been compiled in this paper. We know nutrition is the most essential part, one of the most essential parts of child growth and development and preventive medicine. And impaired nutrition and improper diet can even lead to mental disorders in children. And only a few research papers have been conducted in the Ayurveda field. Now, the objective was to elaborate on the principles of pediatric nutrition in the classical text of Ayurveda. Methodology, all the basic treatises, including Kashyapa Samhita and the Brihatrayi, were searched for principles of nutrition, diet, digestion regarding child health. And all relevant research databases were also searched. Results are presented in a narrative review. Now, coming to the classification of Bala, we all calculate our age from our birth. But the 9 months before our birth is the most crucial stage of life, because this is a period where the diet of the Garbhini or the pregnant lady can even be a determinant of the prakriti of the child. And after birth, the child is classified solely based on the nutrition that the baby takes. That is the exclusively breastfed child and the partially breastfed and the completely weaned child till 16 years of age. And now, let us see Acharya Kashyapa has told that Prakriti is determined by the Annapana that the Garbhini takes during her Garbhagala. Tadrik Prakriteh Tasmat Garbhat Pravriddhi Dehinah. The other acharyas have also mentioned rasaja factors which affect the which is a major determinant of Sharira Abhinivritti and Sharira Abhivritti, Prana Bandha and Pushti of the Garbha. And coming to the Kshirada's nutrition, we know that Kshirada is solely dependent on stanya or breast milk. So, if the breast milk is nutritive, then the Kshirada is healthy because he or she is completely dependent on the milk of the mother. And we know that Madhureva Pibet Stanyam Tatparam Deha Vrithe. That is, breast milk is species specific, not only species specific, but it is baby specific also. And that is why acharyas have mentioned Shuddha Kshira Lakshana. If we see that Shuddha Kshira Lakshana can be known from the organoleptic characters through the Jala Pariksha. This is mentioned in all classics, but Kashyapa has told that how can we know the Stanya Shuddha? It is known from the growth and development of the child. That is, it is known from the increase in the head circumference, the chest circumference, the length of the baby, and also the disease-free state of the child. This is the most important feature that is explained by Kashyapa. And during the first 4 days, crucial for the proper nourishment of the child. It's not, even if the stanya is Shuddha, if the technique of breastfeeding is not proper, it does not properly nourish the child. And coming to the diet in the absence of breast milk, it is told that Ayudam, that is God's milk or cow's milk can be given to the child in the absence of breast milk, and this has to be boiled with Lakhu Panchamula or Sthira, that is Desmodium gangeticum. And sugar has to be added because breast milk is comparatively sweeter than animal milk. It should be Sniktha, that is always we should add oil or ghee to the foods that we prepare for the children. Have been described by Kashyapa. And the Mula Hetus of Ame Utpatti, like Samashana, Mathyashana, etc., should not be followed in case of the child. And the usual food which we take can be given to the child also. Different varieties of food should be tried for children because they always want variety in eating. Otherwise, they will not accept the prepared food. So can non-vegetarian be given? It is told that children who are lean and girls who are lean, pregnant women and Sutika who has gone through difficult labor can be given. This is the last portion of Kashyapa Samhita. So it
Vision of your presentation, that's all. Other than the textual part, other than the collection from the classics, what is the contribution of your presentation regarding the nutrition in child?
Recipes in this, and also I have identified the importance of Garbhini Ahara Annapanadi in determining the prakriti of the child, and also similarly, and there are confusions regarding the selection of food for the during weaning period. That also I think I have made it a little more clearer. That's all.
Okay, thank you.
My name is Dr. Arshia Nasreen. I'm from Government Nizamiya Tibbi College from the Department of Gynecology and Obstetrics. Imagine a strong force that can change even the peaceful oceans go strong. This is what premenstrual syndrome is. I'm going to speak about a holistic approach of Unani medicine in premenstrual syndrome management, as the prevalence in India of PMS is 43%. I will cover introduction, etiology, symptoms, assessment, management, and potential medicinal plans for elevating PMS, and at last I will provide references for further exploration. PMS, during the late luteal phase of the menstrual cycle, female experiences certain physiological, psychosocial, and behavioral changes. These symptoms are collectively known as premenstrual syndrome. And when these symptoms become disabling, it is termed as premenstrual dysphoric disorder. 15% report moderate to severe symptoms, and 3 to 8% meet the strict criteria for premenstrual dysphoric disorder. As per the Asian physician mentioned that अखलात मुहरिका और हार्मोन्स इम्तलाई कैफियत, the surge of अखलात मुहरिका leads to the accumulation of body fluids in tissues places and causes premenstrual symptoms. Causes of PMS are estrogen excess and progesterone deficiency in the luteal phase, low levels of beta endorphins and serotonins, and other causes. Manifestations: PMS manifests as neuropsychiatric symptoms, physical symptoms, emotional symptoms, water retention, and gastrointestinal symptoms. Shared symptoms of PMS in Unani and modern medicine. As per Zakir Razi, describes symptoms of anorexia, lassitude, anxiety, tremors during the premenstrual periods. Ghulam Jilani and Hakim Ajmal Khan suggest that disturbances in liver function causes accumulation of toxins in the body, which leads to premenstrual symptoms. Ibn Sina's plethora symptoms include anxiety, tension, headache, irritability, decreased concentration, insomnia, and other symptoms. This is the PMS and PMDD assessment. Both follow a different criteria. In PMDD, mood-related and plus 5 other symptoms must be present, and it should be present for 2 menstrual cycles. PMS can mimic the other conditions also, such as depression, anxiety, perimenopause, chronic fatigue syndrome, IBS, and thyroid diseases. Other conditions can get worsened during the premenstrual period. These may be seizure disorders, migraine, asthma, and allergy. Management is multifactorial. Etiology requires drug management, lifestyle modification, and cognitive therapy. Yoga and stress management can be applied. Diet manipulation, avoidance of salt and caffeine. Pharmacological management includes antidepressant, prostaglandins, and for ovarian suppression, GnRH analogs and levonorgestrel. How to relieve PMS with Unani perspectives? By lifestyle modifications. Hippocrates is considered as the father of lifestyle modification in Unani system of medicine, as he advised modification of lifestyle habits through diet and exercise. There is also dietotherapy, and unhealthy foods and certain habits worsen premenstrual symptoms. As per Rabban Tabri, health can be maintained by consumption of suitable foods and drinks and evacuation of waste matter from the body. As per Kitab al-Mansuri, mutton soup is advised for depression, irritability, and anxiety. Alternative therapies in Unani medicine are massage therapy, fomentation, and exercise. Introducing sedentary women to exercise has been shown to be beneficial in mood symptoms, fluid retention, and breast tenderness. And Aftimun and Gauzaban can be used up to 450 milligrams in capsule form. These are potent medicinal plants for elevating PMS symptoms. Chamomile is more effective in relieving symptoms. Ginger has shown reduction in mood, physical, and behavioral symptoms. Others also have significant relief of PMS symptoms. The benefit of crocus sativus, that is saffron, is demonstrated in one high-quality study which showed overall relief in PMS symptoms. Vitex agnus castors, that is chambalu or chasteberry, targets the hypothalamus pituitary axis and decreases the FSH and estrogen synthesis and causes a reduction in symptoms of premenstrual syndrome. Bioactive molecules in ginger have also gained significance as they possess sedative, anti-inflammatory, and analgesic activities. Curcumin or haldi, it can control the neurotransmitters accountable for behavior and mood regulation. Cuscuta reflexa aftimun decoction is beneficial in depression, irritability, and anxiety. Chamzoline is present in chamomile extract, is found accountable for anti-inflammatory action and is used in the treatment of premenstrual syndrome. Conclusion: further research is needed to better understand these conditions and improve treatment options within the Unani system of medicine. These are the references. Thank you. That brings us to the end. Thank you very much.
Delegates and my dear colleagues, a very fine good evening to one and all. Myself, Khatija, PG first year, Dravyaguna department from SV Ayurvedic College, Tirupati. And today I am going to present my topic, sleep health. First, let us know about Ayurvedic perspective regarding sleep health. Nidra definition. Yada tu mansi klante karmatmanaha klamanvitaha vishayabhyo nirvatante tada swapati manavaha. When the mind, including sensory and motor organs, are exhausted and they dissociate themselves from their objects, the individual sleeps. Physiology of Nidra. Mind, manas, plays an important role in the sleep. The mind, manas, has 3 gunas, namely sattva, rajas, and tamas. The tamoguna of manas plays an important role in creating sleep. Tamoguna, along with kapha dosha, leads to sleep. When mind gets disturbed due to any thoughts, there will be increase in the rajoguna, which leads to simultaneous increase in the vata dosha, which in turn leads to decrease in the tamoguna, leads to nidranasha or insomnia. Next, importance of nidra. Nidrayatam sukham dukham pushtim karshyam bala abalam vrushata klibata gnanam agnanam jivitam naja. Happiness, misery, nourishment, emaciation, strength, weakness, virility, sterility, Knowledge, ignorance, life, and death all depend upon the proper or improper sleep. Acharya Shushruta has also described that an individual needs to sleep at proper time, and Ahara, Nidra, and Brahmacharya are the Traya Upastamba, the three supporting sub-pillars of the life, which play an important role in maintaining the health of the individual. Divasvapna has been described in Ayurveda, which means sleep during the daytime. This is mainly prescribed during the summer season, as in summer season there will be absorption of fluid and vata gets aggravated, so hence everyone can sleep during summer season at the daytime. Ratri Jagarna means awakening at the night. This leads to increase in the vata dosha and roughness in the body, hence it should be avoided. Nidra Vega Dharana. Vegas are the natural urges of the body which needs to be, which don't need to be suppressed, but through Nidra Vega Dharana leads to yawning, drowsiness, body pains, and heaviness of the head and eyes. Let us know about Nidra Nasha. Nidra Nasha can be broadly defined as the loss of sleep or derangement in the quality and quantity of the sleep. Nidana or etiological factor of Nidra Nasha. Here, excessive anger, excessive thinking, excessive grief, excessive exercise, fasting, etc. leads to are the etiological factors of Nidra Nasha, which leads to Rupa, like we have already seen in the previous slide that Nidra Vega Dharana symptoms are the same as the Rupa of Nidra Nasha. Samprapti Ghataka. All the three doshas have been involved in the Nidra Nasha, mainly Pitta Vriddhi and Kapha Kshaya. Dushya is mainly Rasa. Agni involved is Jataragni. Shrotas is Manavaha and Rasavaha. Shrota Dushti Prakara is Ati Pravritti. Adhisthana is Hridaya and Udbhavasthana is also Hridaya. Chikitsa of Nidra Nasha. Acharya Charaka has described that massage, unction, bath, intake of domestic marshy and aquatic animals, soup, shali anna with dadhi, milk, alcohol, and making the patient listen to good music and smell to pleasant odor, and application of paste to the head, eyes, and the body, along with good bed and comfortable bed, leads to good sleep or help in the prevention of Nidra Nasha. Medya rasayanas like Brahmi, Shankapushpi, which are commonly used for its memory enhancing and antidepressant properties, also promote sleep. Modern comparison. Sleep. Sleep is a state of reduced mental and physical activity in which consciousness is altered and sensory activity is inhibited to a certain extent. During sleep, there is a decrease in muscle activity and interactions with the surrounding environment are significantly reduced. Here, the recommended sleep duration according to the age group. We can see that since birth to 65 years of age, the amount of sleep has been reducing, but on an average, 18 to 65 years of age, old people require 7 to 9 hours of sleep. Stages of sleep. The brain cycles through 4 stages of sleep. The first 3 are considered as non-rapid eye movement, also known as quiet sleep, and the fourth is rapid eye movement sleep, also known as active sleep. During the first stage, it is the transition period between wakefulness and sleep. It lasts around 5 to 10 minutes. And the second stage, the body temperature drops and the heart rate begins to slow. It lasts approximately for 20 minutes. During the stage 3, muscles relax, deepest sleep occurs, blood pressure and breathing rate drop. Rapid eye movement, also known as active sleep, the brain becomes more active, eyes move rapidly, dreams occur, and body becomes relaxed and immobilized. Sleep disorders. Group of conditions that affect the ability to sleep. Pauses in breath during sleeping. Parasomnia, class of sleep disorders that cause abnormal movements and behavior during sleep. It includes sleepwalking, sleep talking, etc. Restless leg syndrome, an overwhelming need to move the legs accompanied by a tingling sensation in the legs. Narcolepsy, it is characterized by sleep attacks that occur while awake. Next, effect of sleep deprivation on the whole body. Memory issues, mood changes, trouble with thinking and concentration, weakened immunity, risk for diabetes, low sex drive, accidents, high blood pressure, weight gain, risk for heart disease, poor balance. So I have compared Nidra Nasha with insomnia. Both modern and Ayurvedic In both modern and Ayurvedic perspectives, we have common etiological factors like dukkha, stress, harsha, happiness, sharirika nidana like upavasa, fasting, and vyayama, excessive exercise. Both share common symptoms like Jumba, Tandra, Shiro Akshi Gaurava, Angamarda, Chikitsa or treatment, Pada Abhyanga or foot massage, which is a Bahya Upachara, avoiding day sleep or Divaswapna Manasika Upachara, having milk Shira before bedtime. Effectiveness of Ayurvedic medicine as remedies for insomnia. A double-blind study has proved ashwagandha reduces non-restorative sleep. Jatamancha along with Brahmi when administered as Tailadhara is the best option for insomnia or nidranasha. Here are some of the herbs with the proven sedative activity. Conclusion. Nidra sleep is an essential act that determines the individual's health. It affects both mental and physical well-being. Ayurveda uses herbal tonics and formulations to relax the body and eliminate the toxins, thereby inducing good quality sleep. Methods like Nidana Parivarjana and procedures like Dhara and Pada Abhyanga help relax body and mind. The herbs and formulations of Ayurveda that are used to treat insomnia reduce anxiety, depression, and other conditions that cause difficulty in falling asleep and sleep disturbances. Ayurveda also suggests yoga and meditation in order to attain mental peace and physical strength. The tonics, food, and remedies recommended before bedtime or after dinner prove effective in inducing good quality sleep. These are some of the references from which I have gathered the matter. Thank you.
Bala Tomraz in Niswa, Gynecology and Obstetrics. Today I'll be speaking about Bukhure Mariam. It is a Unani drug with potential effects on labor. With a very brief discussion, in Unani literature, there are many drugs and regimens for gynecological and obstetric disorders, but one among them is Bukhure Mariam. I am interested in this drug because the most authentic literature of Unani medicine, Canon of Medicine, that is Al-Khanun fi Tib, written by the physician Sheikhur Rais Ibn Sina. He has mentioned in his literature, if a pregnant lady walks on the grass of anastatica, she will abort the conceptus. This line indicates the potential effects of this drug on labor, in inducing labor. Now, what is normal labor? It is the uterine contractions that bring about demonstrable effacement and dilatation of the cervix. Normal labor has 3 stages. Stage 1, dilatation, that is preparatory phase of cervix, and lower uterine segment is formed. In the second stage, birth of the baby, fetus. In the third stage, placental separation and delivery. In 2021, WHO recommended WHO Care Guide. It is a tool to support good quality, evidence-based, respectful care during labor and childbirth. This has replaced the classical partograph which we used to use. In 2021, WHO replaced this partograph with labor care guide. Now, C-section versus vaginal deliveries. Recently, we have known how much percentage of C-section deliveries have been increased in India. That is a matter of concern. India has registered a jump of over 300 C-sections in public hospitals and 400 in private hospitals. But WHO recommends only 15% of the deliveries should be C-section. 15 to 55, our Telangana state tops with that, 55%. So this is the data. This is 311% and 413% in private institutions and public institutions. What is the significance of intervention in labor? If a lady is setting up into labor, anyhow she'll deliver. What is the significance of doing intervention? That is important. To improve the quality of care and outcome of women giving birth, to reduce the intrapartum and postpartum complications. This is a very huge topic. So only just 2 I want to describe. First is meconium aspiration syndrome. This will occur because of the abnormal uterine contractions. Fetus will go into hypoxic injuries and meconium aspiration syndrome will occur. And this has a very bad prognosis that is associated with neurodevelopmental delay and cerebral palsies, which is a huge burden on families. Second complication is prolonged labors will increase the risk of PPH. So keeping these 2 important points in mind, that is the need for intervention in labor is required. So now coming to the drug Bukhure Mariam. Botanical name Anastatica hirochentica, and commonly known as Rose of Jericho, resurrection plant. This term resurrection has given to this herb because during summer season it curls up. You can see in the picture it curls up like that in summer season. In summer season, the plant will curl up its branches, we can see in the picture, and when we replant it, it will again recurl its own branches. So this is the reason we call it resurrection. It will resurrect to the normal phase, what it was before summer season or before drying up. It can stay in dormant state for many years. So once we replant it, it will again resurrect. So that is why we call it resurrection plant. In Unani literature, it has been mentioned as Panje Mariam, Kafe Mariam, Hata Jodi, Mariam Booty. These are all the names in different languages. Now we have a concept of temperament in Unani system. We have divided many drugs into many temperaments. What will they create if we give medicine? So this belongs to the third grade category, Garma Khushk. It will create dryness and warmness in the body if we use this. Now, what are the properties mentioned in Unani literature is Muddire Hez, Laban, Bol, and Muhallile Oram. We translate it as Muhallile Oram is anti-inflammatory effect, and Muddire Hez it is helping in correcting menstrual cycles. And it is also a diuretic. Now, not going into much detail. Next are scientific details. It belongs to the family Brassicaceae, origin is Arabian Peninsula. A lot of studies has been done on this drug. The most important among them is some of the phytochemical constituents have free radical scavenging and prostaglandin stimulating properties. This is the direct connecting link between this drug and labor induction. Been considered as uterotonins. They are synthesized endogenously from amnion, chorion, decidua, myometrium. This point is very interesting. If they are synthesized endogenously, so labor can occur at any time. So the phases of labor, this is different from the stages of labor. Stages of labor is different, phases of labor or parturition is different. These are three phases. Phase 0. Phase 0 comes from conception to phase 1. That is quiescence phase of uterus. Once a conceptus has been there in the uterus has to be quiet until the delivery. If anything happens, if any uneventualities will occur, this phase 0 will activate. That means uterine quiescence will break and the delivery occurs. That is what we call preterm deliveries, abortions and all. If it is occurring, this phase 0 is occurring on time, it is term delivery. It is not occurring, it is post-term delivery. Now, this drug has been studied extensively in Arabian countries. I have collected some few articles. First article is Kafe Mariam, evaluation of gastroprotective activity and toxicity in different experimental models. This study was conducted in United States of America, University of Akamai, in the collaboration with University of Saudi Arabia, King Saud University in Saudi Arabia. They have given in this study, they have taken three groups. Okay. So they have evaluated the toxicity drugs and they have given more than 500 mg per kg per day is a toxic dose for mice. The next study, it has been conducted in Indonesia. They have taken the extracts directly implanted into the histology of myometrial cells and prostaglandin levels they have studied, and they have come up with final finding is that they have given 100 mg per kg per day. This is the dose for increasing prostaglandin levels in a pregnant mice. Now, third article is histological effects of anastatica aqueous extract in female mice liver. In this, they have given, if this drug is used for 100 mg per kg per day for 1 month, then the rat was developing liver degeneration, degenerative changes in the liver. So this creates the long-term or chronic use of the drugs will lead to side effect, its toxicity. The last one is the effect of aqueous extract on anastatica on some hormones in mouse females. So this is also having a direct link with the female reproductive system. So with this, so much articles and so much work has been done on this drug that entire preclinical area has been covered. So in our institute, we have planned a clinical study on this. So putting a ethanolic extract of anastatica with a dose of just 5 ml for per lady. So we have planned a study, and this study will be completed this year under my beloved guide, Dr. S. Hasani Madam. She's not. So that's all for my speech. Thank you.
Right. Hmm. Intervention way means how in group 1. Hmm. 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 Uh, uh, at which stage? At which stage? Labor. Okay. So it is a presumption, means like on the basis of the review and on the basis of other phytochemical studies of the plant. Now, any other study has been done on this plant in a clinical trial has not been done. What this?
अवार्ड कर गया या कोई बात हो गई तो आफत हो जाएगी।
हाँ
उन्होंने ऐसा
हाँ
बताया
हाँ हाँ हाँ
स्टार्टिंग में कि वो अगर उससे चलने से
हाँ।
ग्रास पे चलने से एबॉर्शन हो जाता है। ऐसे आप तो फिर कैसे
हाँ।
यूज कर लेंगे जिस पेशेंट पे यूज करो।
Mental health, it's like a buzzword these days. So, for a person to be healthy, mentally healthy, the seeds are sown during his childhood itself. So, the way their parents behave towards him and the way he's brought up, that impact is very much in his adult life. So, there are mainly four types of parenting styles. As we can see, they are authoritarian, authoritative, permissive, and uninvolved. Among these four, as the names itself tells, authoritarian parents are very authoritative towards their children. So they show so many rules, they set up so many rules, and if they don't follow, they give punishments to them and all that. Because of that, the children may develop decision making problems and all that. And in authoritative, the parents are very friendly. They set up rules, but they explain them why they are setting it up and all that. And in uninvolved, as the name itself says again, the parents are least bothered about their kids. And in permissive, again, parents just give whatever permission they want. Whatever the child wants, they can do. That's it. So based on these four styles, the most which is very useful is authoritative. Those children are very independent and self-confident in their adult life. So whoever is a parent can just take a note of it and see if what parenting style you are following. Thank you.
मैं विनर अनाउंस करूं, चूँकि मोस्टली पेपर्स बच्चों ने प्रेजेंट किए जो एमडी स्कॉलर्स हैं या एमएस स्कॉलर हैं, पेपर बनाते समय दो तीन बातों का ध्यान रखना चाहिए। पेपर पढ़ने में आए जब आप उस पर चला रही हैं, टाइम मोस्टली सेमिनार में 8 से 10 मिनट का मिलता है, तो आपका कंक्लूजन विद इन टाइम खत्म हो जाना चाहिए। और बोलने में कॉन्फिडेंस होना चाहिए। मोस्टली पेपर्स जो हैं वो थ्योरेटिकल ही थे, लेकिन फिर भी रिजल्ट देना है। और रिजल्ट है आसमा, क्या नाम था? आसमा, नाम asma fatima have good score and congratulate him.